Okay. Good evening, ladies and gentlemen, distinguished guests and esteemed participants. Welcome to this highly anticipated webinar hosted by the Saudi Patient Safety Center. We are delighted to have all of you join us today as we gather virtually to discuss a crucial aspect of patient safety and healthcare leadership. I'd like to extend my deep gratitude to the Saudi Patient Safety Center for their commitment in advancing patient safety standards and providing a platform to engage in these crucial discussions. I would like to also express my sincere appreciation to our esteemed speakers for kindly sharing their knowledge and expertise with us today. Let us embark on this journey together, embracing the power of leadership to transform our healthcare system and improve our patient outcomes. I would like to encourage our participants to be active and to ask questions. I hope this session proves to be insightful, engaging, and impactful for all. Allow me to introduce our first speaker. Dr. Arij Aboudan is the Saudi Ministry of Health Head of Patient Safety in the General Directorate of Quality and Patient Safety, as well as being a pediatric emergency consultant. Dr. Aboudan has a special interest in patient safety project management and quality improvement. Dr. Arij has a role in managing Sentinel events in all government and private hospitals. She has publications in quality projects, such as systematic review for multidimensional tools to measure crowding in the pediatric emergency department. And she studied the current capacity and demand of pediatric emergency consultants in Saudi Arabia and the projection of 2030. Welcome, Dr. Arij. The mic is yours.
Good evening, and thank you all for this introduction. Thank you, Dr. Areem. Thank you to the Saudi Patient Safety Center and to the Regional Health Directorate represented by the Quality and Patient Safety Department in Tabuk region. Thanks for organizing committee for this opportunity to present our experience as the Saudi Ministry of Health, Quality and Patient Safety General Directorate in Rising Patient Voice. As you know, patient safety is a global concern and the top priority for healthcare leaders and also policymakers. Saudi Arabia is the forefront of countries that give priority to patient safety. In 2019, Saudi hosted the Fourth World Summit in Patient Safety and Jeddah Declaration, which focused on international standard, guidelines, and actions that address patient safety issues of global significance, emphasizing in low and mid-economic countries. The Saudi Ministry of Health attaches exceptional importance to the patient safety and plays a critical role in raising patient voice. And also, they work to create a culture of patient engagement and empowerment and to ensure the patient voices are heard and valued at all levels of the organization. Leaders set the tone for the organization by demonstrating their commitment to patient-centered care. This means putting patients at the center of all decision-making, being responsive to their needs and preferences, and create opportunities for patients through many well-defined mechanisms. Listening to the patient and acting on their feedback and taking action to address their concern is the top priority. Empower the staff to raise patient voices. This can also include training on how to communicate with the patient, how to collect and analyze patient feedback, and how to advocate or being advocate for patient and ensure the patient are the center of the healthcare system. And now, let me welcome Dr. Areem Al-Anizi to take us through this in her presentation, all this journey, what have been done by Ministry of Health to raise patient voice. Welcome, Doctora.
Thank you, Dr. Arij. Thank you, Dr. Areem. Thank you. First of all, I would like to welcome you all to this presentation. It's an honor, it's a pleasure to be a part of it. Today, inshallah, we will be discussing the role of leadership in increasing the reporting culture and enhancing healthcare system. First, let me talk about the Sentinel event in MOH, or the Nether event internationally. It is with patient safety issue that is not related to the underlying condition or the illness. It could be resulted with death or permanent or severe temporary harm. This affecting us negatively to the image or to the reputation of the healthcare. As well as the financial loss, as we can give an example of if we have like a MRI machine which damaged. It's not about only the MRI machine, no. It's about the appointment and the patient that in the waiting list waiting for their appointment. We have now 32 categories of the Sentinel events or the never events, which is aligned with the Saudi Patient Safety Center. Now we are covering 20 health directories in MOH and private hospitals, 9 clusters, 425 hospitals, or even plus. Let's talk about the role of leadership in enhancing reporting. They can set the rules and regulation. They can initiate the technology and automation, even using the effective communication and engaging patients and family. If the leader initiate the policies of reporting Sentinel event and just culture, they have to start to follow up. Even they start to follow up all the policies and to make sure that these policies are implemented in the health sector. And now we have the Ministry of Health memorandum, which can increase the culture of reporting the Sentinel event and the staff protection. Transformational leadership style leads to increasing the reporting and capturing Sentinel events from patient complaints. In 2020, the reporting of Sentinel event started in 2020. Then we start in 2021 to improve these reporting of Sentinel event by certain KPIs. In 2022, we set a target for this reporting by setting a KPIs and to monitor these RCA, to monitor the reporting of Sentinel event, to monitor even the corrective action plan. So what is the target of the number of reported Sentinel events? Let's flip the coin and make the untargeted targeted. So if we want to say it what is the target? Our target to be a 0 Sentinel event. But for us, we are encouraging the culture of Sentinel event. So we made this KPI for the whole population of Saudi Arabia. If this region is a 2% of this population, so we are expecting from this region to reach the 2% of the whole population of reporting the Sentinel event. As we can see here, the outcome or the impact of this reporting, you can see here the raising culture of reporting the Sentinel event. First of all, we start here with the 937. When we took the complaints of patients, we initiate communication with patients and 937. So to capture these Sentinel events, to deal with it as a potential Sentinel event, to dig more and get more information. Then we start with the culture of a training and what is the criteria of Sentinel event and how to do the RCA. After that, we initiate the KPIs and we start to monitor and to follow up the RCA and the corrective action plan. Now let's talk about the social media and hotline 937. We reached of the transparency in a high level that we start now to dig more and to capture the Sentinel event or the potential Sentinel event even from social media. This is an example of a tweet. We found it on Twitter, which says this girl is admitted to the ER. Then they discharge her within less than 12 hours. After that, she deteriorated. Then she passed away. So we capture this event or this potential Sentinel event in this dashboard. This is a tool. We developed it in a certain algorithm, customized with a certain categories. As I mentioned previously, we have 32 categories, which is aligned with the Saudi Patient Safety Center. We developed now 14 categories. This tool helped us to capture from these categories. How? By adding these keywords, we reached now 184. It includes the Arabic words, the Saudi slangs, even the different regions, the typographical errors. As we can see, some of people can write مستشفى مثلا بألف مقصورة ومستشفى بألف ممدود and so on. To improve the specificity and sensitivity of this tool, even if we captured an event, this tool did not help us to capture this event, we are trying to look for it in a backward or retrospectively to add these keywords to the machine so we can capture it in future ones. Now let's talk about the management of potential Sentinel event. By establishing patient safety complaint framework inside the hotline and 937 platform management. After capturing these Sentinel events, we record this. If we captured it, we are asking the hospitals or the clusters if we are if the hospital are known, or we can ask from 937 to contact the tweeting person to get more information about the situation or the Sentinel event, then to ask the hospitals or the cluster to do the report on the MOH platform of Sentinel event. So this is the framework. When we receive the call from 937, if it's complaint regarding a Sentinel event, it comes to quality department after the manual validation from our committee. If it's Sentinel event, we will ask the hospital to report. If not, it will go to or to be referred to morbidity mortality committee. This is our dashboard in Sentinel event analysis. This tool is reflecting what we have in the platform. As we can see on the left dashboard, it shows us how many reports did we receive on the platform, how many reports we received from 937 and both. It shows us the percent of the MOH hospitals as well as the private hospitals. What is the highest categories? As we can see now, we are high in unexpected death. Then the bubble, whenever it becomes bigger, that means the culture of reporting the Sentinel event, it's better. And the other dashboard, it shows us from where did we receive the reports. Is it from the OVR, it is directly by the staff, or it is by 937 or patient complaint. It shows us even that the percentage of how many reported corrective action plan has been implemented and been done. Also, it shows us even if there is a damage or any of reports that has medical device involvement, we are seeing if they reported to Saudi FDA or what did they do to that machine. So this dashboard helps us because it's reflecting all the work in the platform. So about the digital technology for patient safety, we developed the electronic system, which has 72 structured fields, end user and top management requirements, reporting progress and status. As we mentioned, we have a policy for reporting the Sentinel events. If we talked about the policy, if we captured a Sentinel event, or the hospital captured the Sentinel event, an internal notification should be within, after internal notification, it should be within 24 to 48 hours to report. So we can monitor and follow up the time of reporting and the status of event. If they are working on the doing the RCA, it shows us even if it's progress or been done or closed or approved. Then appropriateness review with 2 levels of external reviewers. Now we did something really helpful. We engaged the subject matter expert of MOH to review the quality of RCA, to improve the quality of the RCA, to give the full support of doing the corrective action plan, to follow up if the corrective action plan, this is really helpful for correcting this situation. We have now the effective communication, the transparency. We have now in National Health Command Center, we have weekly rounds and key marks. We show in that rounds our dashboards, and with all departments, we discuss about the challenges, about the supports we need, about even the current situation, and even if we needed a decision. For now, we can easily communicate in that round. Now we started one-to-one meetings with the regional of equality patient safety directors to encourage the Sentinel event reports culture, to give the opportunity to correct the Sentinel events and never events from happening again, to give the full support if they need. And we reach for just culture by the annual Sentinel event report presentation. We are raising the culture of no blaming culture. We are not pointing to any. We are looking for a health system. We are fixing the system itself. So by saying these meetings, by setting up these meetings and raising the just culture, raising the Sentinel event reporting culture, we reached, alhamdulillah, a good, healthy relationship between the MOH and the MOH hospitals, as well as the clusters, as well as the private sector, by confirming and emphasizing that it's not about blaming the individuals. It's about system and correcting system based on the reports. Here we can see an example of the dashboards we have in National Health Command Center. Okay, patient and family engagement. If we engage the patient and the family, that does not mean that we empowered them. Engaging them it's a must to engage these patients and their families with the whole situation by disclosure, even if if there is a medication or if there is anything that has to be with the patient, it should be engaged. But by empowering the patient for patient safety, we make sure that the patient has the responsibility to be a part of the health system. By knowing their rights, patient and family are centered in RCA. As I mentioned previously, an example of disclosure. The patient has the right to understand the situation and the Sentinel event itself, and how we can even they should be involved in the corrective action plan. Embedded disclosure in the system. We are encouraging now to do the disclosure with all health system, and then the information and education patients and their families. As we can see here, we choose places where we need the full empowering and full engagement of patients, as we can see before any OR, or even if there is a fall or hit in the family sector, or when we give medication, we should explain to the patient that they have the right to ask why they are taking this medication and for how long. Even if we even the budget, they should be involved in all the details to them. And when they are around the hospitals, they should know about the blood banks, blood labs, even when they take the samples for what and to be engaged. And thank you.
Thank you very much, Dr. Reem. Amazing presentation. You really simplified it in a way that we can all understand. I know it's not easy. I know it's a lot of work. Personally, I have communicated with you, with our hospitals, and we have really worked on certain cases. I have a question while we wait for the audience, and we encourage them to please write in the Q&A. But I have a question regarding the resistance that you see in hospital.
Can you let me answer this question?
Yes.
Because I like such questions.
Yes, I know, because we dealt with it ourselves in our hospitals.
Yeah.
So you catch a Sentinel event through 937 or social media, and you request the hospital to enter it in the platform, but they don't agree that it's a Sentinel event. So how do you deal with this?
Okay, we have many approach for such resistance. Usually, first of all, we call it as a potential Sentinel event. We are not call it as a Sentinel event. As you know, we will not be able to say 100% it is a Sentinel event unless they did a deep review. No, that's really agree in the committee that it is a Sentinel event. Some cases really very difficult from start to say this is a Sentinel event. Now we have a lot of things to assure them. First of all, how we are managing and dealing with reporting Sentinel event. If we keep blaming people that because they are report this event, and or keep the people under pressure, or do like any penalty or something with the bad consequence to them, definitely they will stop reporting. We have to emphasize on just culture. Then in the platform, we ask them, okay, sit together, try to do a deep review, come with the conclusion that it is a Sentinel or not Sentinel with clear, strong justification. And if turned to be not a Sentinel, in the platform there is an icon called not confirmed Sentinel, so it will not be counted as a Sentinel event. This is one thing. The other things, as Dr. Reem mentioned, the KPI, which is counted in the leaders of the hospitals, about what called expected reported Sentinel event. This is very strange KPI. How you will put like, we need from you and to report, and you have to have a target of Sentinel event, which is totally opposite of the, we have not to be harmful in our healthcare system. But whenever we are in the advancement of the healthcare system, is still we will have and safety issues need to be reported. Now we ask them to have a target which is unknown for them and changeable month by month. And this KPI is counted in the head, for example, of the hospital. So in the leaders, not in the quality department, not in the staff. So the director who before say for his staff, please don't report Sentinel event. Now he is come and knock the door for the request. Please, if you have reported Sentinel event, please report it in the. So we change the mindset. We encourage them to report. The aim to do at the end review. Definitely, after reviewing the case and come out, definitely you will find some something to improve. And this is our aim, not to increase the reporting by itself or to increase the Sentinel effect, to do deep review and to improve and do corrective action plan. This is our aim at the end.
Thank you. You actually answered my next question, which was the KPI or the target, because it was a little bit confusing that we want 0 Sentinel events, but you have a target that changes monthly. So you just clarified it.
Yeah, and this KPI is developed through many months. Actually, we started with the bed capacity, then we'll go more with the population. It's at the end we come finally after investment from the leaders to encourage reporting. You know, the tone in the hospital, in the MOH or the Ministry of Health, and their mindset is toward reporting. And also not to blame. As you see, when she present the picture of the round, they encourage of reporting. And when we put the ranking of the region or hospitals, we start by the lowest reporting to focus in the why they are not reporting. Yeah. So all of this is come with the leader in investment and engagement to improve reporting, and also the tools to raise the patient voice, either from hotline, the 937, or from the Twitter.
Thank you, Doctor. I have a question here in the chat from Eveline. How will you increase the awareness or encourage the staff in reporting any Sentinel event in their hospitals?
Okay. Again, many ways. The increase and spread the positive culture of reporting is initially come from actually leaders of this institute. If we ask the people to report and then we blame them or let them go in very difficult consequence, how will expect from them next time to come and report? If we put a corrective action plan, which is weak or not up to their expectation now, and we didn't follow this implementation of this corrective action plan, how we will expect from them to come and report? So the reporting, the aim of the reporting to improve the healthcare system. And if we balance the patient right with the hospital right to know the opportunity of improvement, and the staff right, who is as a second victim in some of the cases, this is the only way. If we do this balance and implement it and follow with trust, the people will trust us. And they will see the benefit from reporting of the either Sentinel event or any kind of safety event.
Absolutely. There is also a question regarding the patient experience, how you record complaints from 937. This question is asking how patient experience staff can be involved in national initiatives or improvement projects. Are there any examples of this collaboration within MOH?
Yes, now, we are not encouraging only reporting, we encouraging capturing. So some of the tools is like MOH, the complaint from 937, there is Twitter. The next step, inshallah, will be the patient experience. The patient experience, when we sit with them, we have a big opportunity of comment which can really utilize to improve the healthcare system. And this is really the patient voice, what we need to utilize to understand what we are doing with the patient, to listen for their preferences. This is very important to us, very precious comment. We need to really read it. You know, the 937 complaint, we read each complaint come to the quality. As you see, there is maybe 1,000 of complaint come daily. There is specific categories come with the parallel pathway to the quality department. Those it's come sometimes in hundreds complaint. We read each one. Not only this, we read the hospital comment and compare each together to validate. Even if the hospital says this is, we are not seeing this is potential, we say no, please, still we consider it as a potential, again not as a 100% Sentinel. Please do RCA and let us come at the end after 30 days with conclusion.
Yes, thank you. It's really impressive how you filter all of these complaints and really come up with the actual Sentinel events. And I know you cover government and private hospitals, so that's
yes.
I have a question regarding the algorithm on social media. You talked about it briefly, and I think it's amazing that we're advanced to this level and we're working with the algorithm. But what do you do if you cannot find details from a post or a tweet? How do you?
Nice question.
Of the Sentinel.
And it's happened. You know, we start this algorithm, we establish it with the specific keywords. Then this algorithm and this tool start to retrieve this tweets that contain some events. Then in some occasion we capture tweet which is not captured by this tool. So we did more, analyze it more. Sometimes it's because of a spelling mistake. Sometimes because of words not included. So we start to enhance and modify more, do modification in our tools, improve our tools in capturing. So we include some of the spelling mistake, which is common spelling mistake in some, you know, in Arabic, some like Hamza up or down. It's make a difference in capturing the Sentinel these tweets. So we keep, like, we are learning with this tool how to make it more sensitive. It's very difficult to make it specific, but at least sensitive because it's a screening tool. We need to retrieve more. To make it specific, we can do this, but at that time, maybe we'll lose some tweet. And you know, the tweet is like huge area. You know, in Saudi, why we use the Twitter? Why not Snapchat? Why not other? Because you know, we are one of the country commonly use the Twitter, and people like to ventilate in Twitter. And sometimes you see some trends about some issues in the healthcare system. So this is an opportunity for us to utilize it for improvement and to give the patient right.
Absolutely, and I know you caught a lot of Sentinel events through
yes.
Twitter, so that's been amazing. Regarding the Sentinel event categories, the 32 categories, are they going to change or be updated anytime soon? Are they going to increase, or for the time being, this is the MOH Sentinel events that we're following?
Yes, this is also a good question. You know, we will work together with the Saudi Patient Safety Center to do the new workshop to look for these categories. You know, we learned a lot over this last 2 years about these categories, and it's really some of the categories. It's what, like, at that time we are very think really we will have a Sentinel event on these categories, but after that, really, we learn a lot, and definitely we will have some modification in some of the categories, and also to increase, definitely not to decrease. We will see, inshallah, with this workshop.
Thank you. I do see someone raising their hand. I'm not sure if they can speak or just type the question for me. Okay, while we wait, I want to ask about the Ministry of Health memorandum. It is very strict and very clear to the hospital, especially leadership and administration. What do you do with hospitals that still don't report, even though they know that they will be held accountable legally?
Actually, I do want to say, but this is, this is the last solution. Actually, we have a mechanism of escalation mechanism, but this is, we will use it at the end. And this escalation is come to in level. We will start by escalation within the institute itself, then to the region, cluster, to the MOH, even in the MOH with different level according to the hierarchy. But at the end, we ask them to report. And always this escalation mechanism is successful.
Yes.
But actually, we didn't use it a lot. Very rare, because people from first time, really, they, alhamdulillah, we have a good culture of reporting. Very rarely we use this escalation mechanism.
Yeah, I was just gonna say it's all about the culture, and this is what caught my eye. The title of this webinar is the role of leadership and culture and learning system. I think we're getting there slowly. I think hospital and staff are starting to understand, even if there's a little bit resistance. I think we're in the right path. And I know MOH is there to guide us and to support us, not to punish, and use this memorandum. And we've seen it in our hospitals where you have been very patient with us in explaining why this is a Sentinel event and why it needs to be reported. So that your role is really getting to us and touching us. So again, I'm asking the audience if they have any question. I don't see anything in the Q&A window.
Maybe the one who is raising hand.
I cannot control it if the IT can give access or it's just muted for all. But let's just take this chance. If you have anything you would like to add, Dr. Reem, Dr. Arij, regarding this topic.
Let's start with Dr. Reem.
The MOH did a lot of effort to increase this culture, not to blame, just to raise the culture of reporting Sentinel event, to fix the system of the healthcare, to give the opportunity of the full support and the opportunities to the leader to fix the system and to be part of it. And now we are encouraging, even the patients are part of it, even their families. They are a decision maker with us. And by digging in social media, we are proud to say that we reached a high level, to be honest, of transparency to raise these voices and to see what's right and what's wrong and to fix it. And I will leave you with Dr. Arij.
Dictora, I do see some questions before you conclude. Maybe we can take these questions. How will you deal with the family during the disclosure meetings with the cases of Sentinel event to one of their family members?
Yes, actually we have a policy for this, but what we realize is still the hospital culture is not really well prepared for the disclosure. The disclosure is a very big issue, or it's very important, and it should be done appropriately to get this benefit from it. So we are thinking, actually not thinking, we are in process to do a huge program for improving culture for disclosure, and to train people for this, and put the policy with, or advance or update our policy with feedback from the end user, the healthcare worker, the people who will do disclosure, because it's really very important to listen from staff what is make it difficult for them, and also will engage patient, and maybe, we don't know, next year we will present this outcome.
Yeah. Absolutely. This is a nice question. How do you ensure that lessons learned are effectively communicated and implemented across different organizations?
This is really a great question. You know, we are trying to do a feedback of the Sentinel event. For example, in Riyadh region, we have 3 clusters, and everyone have their own department of quality and patient safety, and they have their own reports, cases. So we are doing in the OMH level report for all Riyadh region, and we can sit together and explain for them what is the common contributory factors and what is the common recommendation need to be done for a specific catchment area. So this is, it really help. We are in MOH level. Some of the event, it's like it's managed or deal with at the level of the MOH, because we from the reporting we find some hospital have all, more or less similar event. So we tried to make it open the MOH, the RCA. We come out with the recommendation, which is can be applied for all sectors, and also producing alert to improve all healthcare, to be utilized for all healthcare system. And we have a lot of example about this. One of them was about event happen like snake bite. Now we are in process to have a unified policy, regulation on transporting such a condition from primary health care to the hospital, and which this is come and listen learn, and the benefit will be across all over the institute, all institute.
Thank you, Dr. This is also an interesting question from Dr. Muhammad Mustafa. How can we accurately measure a psychological harm that rises to the level of Sentinel event? What is the objective criteria for a psychological harm to be considered a Sentinel event?
Yes, this is really, we face a difficulties in estimate this psychological harm. But we really, as a criteria, we read in the literature, and sometimes we need to have like a subject matter expert to have this input in assessing how much is the harm happen for this, for example, staff or for the patient. So really we need the expertise to assess this level of harm. But let us to say at the beginning, from the start, for example, if staff exposed to the violence, and now he had some harm, but this harm is psychological harm. So how we can assess the level of the harm so that we can say this is a Sentinel event. Because we have zero tolerance in the MOH for the staff to be affected or assaulted. So whatever reporting of the level of harm they feel, we consider it as a Sentinel event. For example, if they feel unable to back to the work, or feeling just feeling of unsafe or insecure to come back, this is we consider it, because we have zero tolerance to have this violence or assault, staff assault. So for that, really we encourage to report of the as a Sentinel event.
What about the victim program, Doctora? Is there a plan for that on a national level?
What was it? What is it?
Second victim.
Yes, second victim is very important, definitely. Maybe it will lead by the human resources, actually. They want to really start to work on this program. But now we have a just culture. We encourage always to build the culture of for the staff to feel safe for reporting or to speak up. And whenever we have this, we build our system and all policies. We consider this culture of making people really safe. The minister memorandum mentioned clearly that any staff exposed to any bad consequence, because they report, it is his right to escalate this issue and to investigate the situation and take his right.
Okay, thank you very much. There is also another question. Can we consider mismanagement a Sentinel event if resulted in a death of a complete disability?
Yes. Also, the people with oncology, sometimes the people with cancer, they expect poor prognosis, but if there is a delay in recognition or treatment because of system error, we consider it as a Sentinel event if lead to death.
Thank you for clarifying this, Doctora. I'm checking the chat. I think we covered most of the questions. Some of it was duplicated. But amazing effort, amazing presentation, Dr. Reem. Your answers, Dr. Arid, has really helped answer a lot of the questions that we've had. So in the end, I'd just like to give you, Dr. Arid, a few words to conclude.
Thank you all for this opportunity. Really, it was amazing that you let us to share this experience. Really, all of us with the patient and RISE patient voice, and we encourage all of the audience to come and visit us in the Ministry of Health and see our work in close. Thank you so much.
Thank you, Dr. Arij. Thank you, Dr. Reem. I also encourage everybody to visit. I've been there. The dashboard is impressive. The work is impressive, and you do amazing work. So hopefully we will all work together. It's teamwork. It's everybody's responsibility, not just MOH, not just quality directors or patient safety. It's everyone's responsibility. So I'd like to extend my sincere gratitude to the Saudi Patient Safety Center for hosting this. To our distinguished speakers, thank you for answering all our questions and clarifying everything. And to our audience, of course, thank you. We've had a great number, and they were interactive as Dr. Reem was speaking. So thank you all, and have a good night. Thank you.
Thank you. Good night.
Thank you.